You're listening to MuniCast, the podcast that discusses municipal leadership. Season 4 of MuniCast is brought to you by SaskTel's Innovation and Collaboration team. SaskTel can help you sort through the noise to create solutions that add value quickly. Whether it's reducing your environmental footprint, driving investment, community development, or just saving money, contact your SaskTel account manager to find out more. MuniCast is hosted by SUMA, the voice of Saskatchewan's hometowns. I'm Stephanie, SUMA's Education and Events Coordinator, and in Season 4 of MuniCast, we are tuning in to the 2023 SUMA Convention and Tradeshow and speaking to some of the key participants. On this episode, I'm joined by Minister Everett Hindley, Minister of Mental Health and Addictions, Seniors and Rural and Remote Health, and a participant in SUMA's Bearpit. The Bearpit session at the SUMA Convention is a great opportunity for municipal leaders to connect with provincial ministers to ask questions and make their concerns heard. We look forward to the dialogue that happens in the Bearpit session each year. SUMA's current cornerstone advocacy issue is mental health and addictions, and we are thankful to have this opportunity to ask some of the questions that we have for Minister Hindley before the SUMA Convention in April. Minister Hindley grew up on a family farm near Melfort, Saskatchewan, and had an early career in broadcasting before working for MLA Brad Wall in 1999. In 2018, Minister Hindley was elected as the MLA for Swift Current and was re-elected in the 2020 provincial election. During his years of public service, Minister Hindley has been part of several international trade missions, helping to promote Saskatchewan's interests. He is a member of the Sask Builds and Management Committee and currently serves as the Minister of Mental Health and Addictions, Seniors and Rural and Remote Health. Welcome, Minister Hindley, and thank you very much for joining me today for this conversation.
Hi, Stephanie. Great to be here.
As you know, SUMA's current cornerstone advocacy issue is mental health and addictions. It's important to us that we advocate on this issue whenever we have the opportunity, as it has been a growing concern for many Saskatchewan municipalities and citizens. What programs and services do the government of Saskatchewan have available for individuals dealing with mental health and addictions?
It is a growing area for us as a government, and I know for municipal leadership as well. Something that I've heard about when whether it's at the SUMA Convention or speaking directly with mayors and councillors right across Saskatchewan. You know, I'm fortunate to serve as Saskatchewan's first Minister of Mental Health and Addictions, and in the past couple of years that I've had the opportunity to serve in this capacity, we've been trying to expand upon some of the programs and supports that we do have. We're spending record levels of funding into the area of mental health and addictions. In this year's budget, it's about $470 million that we're spending on any number of programs and services. And whether it is, in both of these areas, whether it's in the area of addictions, in prevention and harm reduction and treatment, long-term treatment and recovery options, or in the area of mental health, whether it's, as an example, the expansion of some of our programs, such as the Mental Health and Addictions Information System, the expansion of walk-in mental health clinics, some of the virtual options that are provided out there. And I think another area of importance for us as well, and something that we're striving towards, is better cooperation and collaboration between ministries, because this isn't, this is a multi-ministry and frankly, a multi-ministry approach, but also frankly, a multi-jurisdictional approach too, between us, the federal government, municipal leadership as well. And just from the government of Saskatchewan's perspective, we're trying to better align the services and programs that we do have so that we can identify where there may be gaps. We, for example, we fund programs and supports directly through this ministry, but some we actually jointly fund, perhaps with social services or with the Ministry of Education or the Ministry of Corrections and policing. So we want to make sure that we're providing those supports and making sure that it's better coordinated and well coordinated for people so that it's easy to be able to access, find that information, and that they're able to get that the information that they need and when they need it and where they need it as quickly and efficiently as possible.
You really touched on some of the key things about why this is so hard to address. It is such a large issue. It crosses so many different areas, different jurisdictions, and there can be gaps in that. So that alignment is such a key thing. According to some of the leading experts in the field, addictions issues are caused by some form of trauma, access to addictive substances, and significant stress. We've heard a lot about how the province intends to step up enforcement, but what sort of plans does the province have in place to better address trauma proactively and to reduce major life stressors such as food and housing insecurities?
Yeah, it's a great point, and that's what we're also trying to drill down to as well. What leads to some of these the challenges that people face and ends up putting them in a situation that they currently find themselves in, because we can spend all kinds of money towards any number of programs and supports, but if you don't drill down to what's that individual person's what's their circumstances and how did they arrive at that, and how can we help address some of the underlying causes. And I think you've touched on it. There might be any number of reasons that a person finds himself in a situation of mental stress or anxiety, or in an addictions challenge. And it could be, as you said, it could be trauma from something that goes back a number of years. It can be, not having stable housing, for example, or employment, as an example, or some other instances like that. And so it's important that, in addition to providing the supports, and that's, we're grateful for all the providers that do that, whether it's healthcare professionals or those in the area of mental health and addictions, frontline support workers that do just outstanding work, and many of them, frankly, do it having lived and living experience. So they've been down that path. And that helps them when they're trying to help other people with this. But I think it's important that we do try to identify that. And as an example, we try to do that when it comes to helping someone with an addictions challenge. And more often than not, that's often tied to not always the case, but it's often tied to a mental health struggle, and then it leads to an addiction. And then how do you break that cycle? So I think it's important for us. And while we do focus a lot on treatment and recovery and a pathway to that to help people with those struggles, we also try to get down to what is it that's got that person in that situation in the first place. So and I think that's where you're starting to see, as an example, if we can be more preventative in nature when it comes to these things. Just as one example, we're expanding a program called Mental Health Capacity Building in Schools. Started off as a program, a bit of a pilot project 2-3 years ago, based on the data that we got back and what we were hearing back from the first handful of schools that initiated that program. Was working very well. And so we recently had it funding in this year's budget, and then expanded that into more communities this summer. And frankly, there was more. There were more applications that came in than there was funding for, and which is I guess a good problem to have. But we think that that's just one example of where, if we can, in the area of mental health, we get those supports in front of kids at a younger age, perhaps we can help address some of those things before they become bigger challenges for them as young adults and adults into the future.
Absolutely. I've seen some of those reports coming out about the schools and the mental health, and teachers especially are really seeing how students are struggling and are really pushing for some of those programs in the schools. And it's so important to address that at an early age so that they have more time to sort things out and move forward with their future in a productive way. One of the challenges for small and remote municipalities in Saskatchewan is the ability to access mental health and addiction services close to the community that they live in. Which municipalities can mental health and addiction services be accessed in? And are there any plans to expand access to these services into smaller communities? And what role does regional collaboration play within that?
Yeah, it's a great question. And it's something that I think, is a little bit unique to Saskatchewan. And, not that this doesn't happen in other provinces and territories, but we do have a very sparsely populated province when you compare us to other, jurisdictions in the country, in Ontario or Quebec, for example, or BC. And so it does make it challenging, because as we're trying to make sure that we provide access and supports and programs and services to people, we know that it can be a challenge to do that, because it's, while we see that perhaps the highest concentrations of the need for these supports in a place like a Saskatoon or Regina, or even in our regional centers like Swift Current, where I am, or a Yorkton or a Prince Albert, it doesn't mean that there aren't similar challenges that are posed or felt in other communities that might be, towns, villages, First Nations, northern and remote communities. I know it's something Jim LeMeg, the MLA for Athabasca, who serves as the legislative secretary alongside with me as in the area of mental health and addictions. I know it's something that he hears about up in northern Saskatchewan. I've had the opportunity to travel around this province and meet with community leaders and those that have an interest in this area. We have expanded, just as an example, the mental health walk-in clinic program that's run by Family Services Saskatchewan, and it's been expanded in the last couple of years, including this year's budget, where it's now getting into communities that haven't been previously served by that service, Moose Jaw, Rosetown, Kindersley, as an example. We now have that service in 31 communities. And I'd argue it probably isn't enough, because there's other communities that say we could use that service as well. So I think there's an opportunity to look at further expanding those sorts of supports. That complements some of the more intensive mental health supports that we have through the Ministry of Health and government related supports. But this is another avenue for people, just like virtual is as well. And I know when talking to community leaders in northern Saskatchewan, that's another barrier as well, is being able to, how do you access that? Just because you don't live in a major center, that shouldn't mean that you shouldn't have access to some support. So I think there's an opportunity to continue to try and roll this out, either by having more of these types of, whether it's walk-in mental health clinics in communities across Saskatchewan. Sometimes it might be mobile services, trying to meet people where they're at and having some flexibility that way. The ability to use virtual options as well. And if there's one thing that we've learned in the past couple of years of going through the pandemic and some of the restrictions that we had to deal with during those times, it was the ability to utilize virtual services as well. Not that replaces a face-to-face visit or a clinical visit, but I think it can really be an important factor in that as well, and people become more comfortable in that. So I just think it's something that that we're trying to do as a government, is making sure that we are providing these supports to as many people as broadly as we can, regardless of where they live in this province.
I really like hearing about how those services have expanded and the different ways that they have, from the mobile services to the virtual ones. I think that's so valuable for being able to connect people, especially when it is hard to get to those in-person services. Across the province, SaskTel is engaged with many different municipal organizations who seek to innovate. Contact your SaskTel account manager to learn more about some of these initiatives and how they can help your municipality today. Having a stable and reliable and safe place to live is a foundational need. It reduces the incidence of mental health problems and addictions, domestic violence, hospital admissions, arrests, and incarceration, and both violent crime and property crime. Are there any plans for the Ministry of Health to work with the Ministry of Social Services to make better use of the 3,000 vacant social housing units in the province?
Yeah, it's a discussion we'd be having with the Ministry of Social Services and the minister there. They're responsible for that area of government when it comes to social housing and the housing units that are available in the province. What I would say is that I think it's something that we're trying to do, not just in this area, but generally speaking, as a government, is to be, and I kind of spoke to it earlier, but is to be better coordinated and better aligned, and less of a silo approach between our ministries and between different levels of government. So, those are conversations that I think are probably happening as we speak. I know just locally in the community that I represent as the MLA here in Swift Current, I know that there is close collaboration between local officials with social services, with the Ministry of Health, as well as mental health and addictions, as well, including education, some of these other areas as well, making sure that, that we do have everybody working towards the same common goal, I think, in terms of, improving situations for people that find themselves in these challenges. An example I can give that, kind of speaks to this, but, is through, we're funding and will soon be launching a program called Integrated Youth Services. And that is based on a model that's been utilized in some other provinces, where we're coordinating a bunch of these different ministries, essentially into kind of a one-stop shop for youth to be able to access supports to government-related programs and services. We recently announced a contract that's been signed with the John Howard Society in Regina, which will serve as the provincial lead on this, and to get our first 3 integrated youth services projects up and running in the province, with hopefully the opportunity to expand that once we get those ones off the ground. And again, that looks at all areas of government: health, social services, housing, corrections and policing, education, any number of these areas, the justice system as well. And I just think it's something that is a goal for our government and a priority for us to make sure that we are all working together and making it easier for people to access those supports, whether it's housing, whether it's any of these other things that they need.
The conversation about mental health and addiction support has also included natural supports, the people within a person's social circle. In remote communities, this often means friends, family, and other informal supports take a large role in mental health and addictions care. What programs and services does the government of Saskatchewan offer to aid these natural supports?
Yeah, excellent question. And I think that speaks to how flexible we have to be when it comes to what types of programs and supports work for individuals, right? What may work for a person in Regina might be different in, a northern community. And we need to be able to not only respect that, but to try to facilitate and foster that as well. And, I think some of that is, can be dealt with through some of these initiatives when it comes to, like I said, the walk-in mental health clinics and virtual supports. But there's some other unique avenues that we have to also factor in. As an example, about a year ago, we provided some one-time capital funding to a wellness camp up in Pine House, up in Northwest Saskatchewan, where it allowed them to. It was operating as kind of a seasonal type of wellness camp for individuals in that area, but they weren't able to operate in the winter months. We provided some capital funding to help them be able to run that program 12 months of the year. And essentially what that is it's a land-based traditional cultural healing type of method that they use for dealing with mental health and addictions for community members in that area. Something that works very well in that area, and I think is there's some interest in it being replicated in other parts of the province as well. So that's just one example of where you need to be able to kind of tailor that particular program or support to the needs of the residents in that region, because it doesn't do it any good if it doesn't factor in some of these other challenges that they may face, and frankly, what some of their historical or cultural learnings might be and their background. So, and I think that's something that we're also trying to make sure that we're focusing very closely on. We do have a partnership with with FSIN as an example, when it comes to funding for whether it's suicide prevention awareness initiatives and mental health and addictions initiatives. We provide some funding to them through a partnership that we have. As an example, in Saskatoon, we have a couple of funding arrangements with the Saskatoon Tribal Council, both for some mobile addiction supports, but also a new mental health support, mobile support in the city of Saskatoon for their member First Nations that are part of the Saskatoon Tribal Council. So those are the discussions we have with First Nations and northern and remote leaders to make sure that we're tailoring what we're doing so that it really does have a positive impact for their community members.
There's some really great feedback on those land-based programs as well. And not only the results that they've had for the individuals that go through the program, but for the community as a whole. So it's really nice to hear that they will be expanding. What do you see as the role of municipalities being in supporting the mental health and well-being of their citizens?
Well, I think there's an opportunity for us to all be working more closely together as government leaders at the municipal level, the provincial level, and federally as well. I'm very grateful when I've had the opportunity to, as an example, be at the SUMA Convention. And whether it's in some of the breakout sessions or the Bearpit, these questions come up. I know that SUMA does have, they have a working group that has a number of mayors specifically focused in this area of mental health and addictions. I recently had an opportunity to chat with the mayor of Yorkton, Mayor Hipsley, in terms of leadership that he's providing in that, along with the other mayors that are serving on that working group. And we've had a number of those conversations with couple with the working group, but also individually with mayors as well. I've had that opportunity to have those discussions, and we really are all. It's interesting because we'll have these discussions about what is it that the provincial government is trying, what seems to be working, maybe what perhaps isn't working as well as we'd like. And then I'll ask the similar questions from municipal leadership. And, when I was earlier this summer, I was trying to get around to visit as many communities as I could as the minister responsible for mental health and addictions and seniors and rural and remote health. And whenever I did that, I'd pop into a community and talk to the local mayor and council or the reeve of the RM or whoever it happened to be. have these discussions about what is it that you're trying here in this community. What are some of the unique challenges that you face here, right in this neck of the woods that you're in Saskatchewan, and what seems to be working? What advice can you give us as a provincial government? Where can we perhaps provide some support as well? Where can we, as I spoke to earlier, kind of tailor some of the programs that we're offering in some other centers to perhaps help out in this community? So I think everybody is very much aligned in what we're trying to do, recognizing that this, the area of mental health and addictions is a growing area for all governments. It's a growing area of conversation. It's a growing area of concern for all of us. So I think we're all trying to do as much as we can to work closely together to make sure we're providing the best possible support we can for the citizens that we're elected to represent.
And as you said earlier in our conversation too, these issues are federal, provincial, municipal. And so having those conversations, especially between the provincial and the municipal governments, is so valuable and can really help everyone move forward. Because as you said too, we're all just kind of trying to figure it out as we go along and address things in the best way possible. You have participated in SUMA's convention in the past, and we're looking forward to having you back in our Bearpit at Convention 2023. The annual SUMA Convention is a great way for our members to connect with not only each other, but with the provincial government. And that Bearpit session is a staple of the convention. It provides our membership with an opportunity to speak with provincial leaders directly. What do you feel is the value of provincial ministers attending the SUMA Convention?
Yeah, it's a really good opportunity, and not that these conversations don't happen throughout the year in each of our various portfolios, and not only that, as MLAs, right? In our constituencies that we represent, we also have these conversations, these discussions, these debates about some of the directions that we're taking. But I do think it's a really good opportunity for us. I've had the opportunity to do it a couple of times now at the SUMA Convention, and it really is a great chance to connect with local leadership, mayors, councillors, administrative folks in various municipalities right across this province to really get a temperature check of what's going on out there. And again, I think we really endeavor to make sure that that's not the only touch point, that we continue to have not only the conversations, but make some decisions about where we're going in the future. And that does, that plays an important role for us. I know for me as the minister, when we head into the SUMA Convention, we obviously try to, think of what might be coming up and prepare for the discussions that will be raised there. But as we prepare for the budget cycle and go throughout the year on an annual basis, trying to factor in what is it we're hearing from municipal leadership in terms of being those that are, I would argue, are most closely connected on the ground, even more so than us as provincial politicians, but people that serve as mayors and councillors for the municipalities are really plugged into what the priority areas are for their communities. And so we take that back. I take that back as a minister, and I'm very grateful and appreciative of the feedback we get and the open and honest conversation we have on these issues. And sometimes we don't always necessarily agree or see things the same way, but I think it's important to have that, to be able to have that open, honest conversation and debate and discussion. But I think more often than not, we're working together on these things. We're bouncing ideas off of each other and trying to find just the best possible way that we can to support the people that we're elected to represent, whether it's provincially, municipally, right across the board.
That's wonderful to hear. And as you mentioned, there are plenty of opportunities to connect between the provincial government and municipal leaders throughout the year. But we really enjoy having that session as that one opportunity that we know everyone will be in the same room. It just has such a great atmosphere to it, and we appreciate you being a part of that. So that brings me to the end of my questions for today. Thank you very much for taking the time to speak with me. I know you have a very busy schedule. I did want to end our conversation by giving you the opportunity to let us know about any other exciting initiatives that the Ministry of Mental Health and Addictions and the Ministry of Senior, Rural and Remote Health has been working on.
Well, that's an open-ended question. I could spend a lot of time on that, but no, just a couple of things. I think there's a lot going on in this area, and continues to be programs and projects that are underway. We're building now for the spring budget, of course, and that work starts very early. As a matter of fact, it started back in the fall, and taking a look at taking stock, I guess, essentially of the programs and supports we do have, what's working, what perhaps needs to be tweaked a little bit, and kind of making those decisions now as to what direction we need to take this in the months ahead as part of the next budget cycle. So I think we'll have more to say about that. in due course here. I guess I would just say, there is a lot in this area that's happening, and I think we're trying to make sure that the dollars we're spending, which are significant, that they're actually making a difference in people's lives. And so we need to make sure that that's always the end goal for us as a provincial government, that we are, providing the supports that are required out there as best we can with the dollars we have, and trying to reach as many people as we can. There's lots of other things going on in this ministry. Of course, there's a lot of talk these days about healthcare and staffing, human resource challenges, and some of the temporary service disruptions we're dealing with right now and trying to deal with, and lots of exciting work happening in there. Minister Paul Merriman recently was on a recruitment mission to the Philippines, and a number of job offers have been provided to folks there to come work here in Saskatchewan. I've been trying to do some work when it comes to local staffing issues with a new incentive program that we have, and just trying to do everything we can to make sure that we're enhancing and expanding our healthcare workforce in this province as part of our 4-point Health Human Resources Action Plan to recruit, train, incentivize, and retain healthcare workers. So lots going on in that area, which of course also impacts mental health and addictions. And, we're having conversations now with our officials about what do we need, not only in the months ahead, but the years ahead. And those are conversations with advanced education about training. Are we training enough mental health counselors? Are we training enough psychiatrists? Are we training enough registered psychiatric nurses? Because this is, as I said earlier, this is a growing area for us as a government. We need to be prepared for not just the short-term challenges we're facing, but more medium and long-term. So it's going to continue to be a priority for me as the minister and for us as a government. And I just end by saying thanks to SUMA and all your members for everything you do representing the municipalities right across this province. It's valuable feedback and just vital for us as a government to be able to have that. And we're grateful to have such a great working relationship with your organization. And with that, just thanks for the opportunity here today.
This brings us to the end of another episode of Municast. Episode 2 of Season 4 features a conversation with Andrew McDonald from Wanuskewin Heritage Park and will be released on February 8th, where we discuss the history of the site and what the future of the park looks like. During the 2023 SUMA Convention, attendees will have the opportunity to take an excursion to Wanuskewin Heritage Park to experience it for themselves. Thank you for tuning in. We hope you enjoy listening in as much as we have enjoyed having these conversations.